Coming up on the Doctor's Hospital
Get
podcast.
to be that first touch and you get to calm those fears.
It is a rewarding profession. There's endless opportunities for continuous learning.
We see a lot of pain, we see a lot of suffering. You need a change of environment, you need a change of pace.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director at Doctor's Hospital. And this week, we are celebrating both in the hospital, nationally, and around the world, Nurses Week. So we are happy today to be joined by three members of our nursing team who are going to talk about their experiences, what led them into the career of nursing, and share some, different tips and things that they've learned as they've gone through their training as well as their career to this point. So we are joined this morning by Juliatta Leary, who is a registered nurse in our post-anesthesia care unit, Gerard Smith, who is a registered nurse and a nursing supervisor, and Miss Sharlene Sanderson, who is also a registered nurse and a nursing supervisor. Welcome to the podcast.
Thank you.
Thank you for having me.
So I like to start at the beginning and hear kind of people talk through their journey into their career path. So my first question, and this is for everyone, can you share a little bit about your journey into nursing and what inspired you to become a nurse? You start with Juliatta and go around.
So for me, my nursing journey started at a very early age. I basically grew up in a clinic in Eleuthera with my grandmother. She has a chronic illness, so we were in and out of the clinic from I could even begin to remember. And also for me, I was asthmatic, so sometimes at school, in primary school, I would have to go to the clinic. So I basically was around nurses from young, and I just was encouraged by them, and I wanted to be like them because they were the people who made me and my Grammy feel better.
Okay. Gerard?
Well, my nursing career basically was influenced by my love for the sciences. In school, I was always a science buff, and I was always into really caring for people and about people. And so I think that was one of the main things that propelled me. Similar to Julia's story, I also spent a lot of time around the hospital too, especially in that asthma bay. I knew PMH very well.
Okay. Charlene?
My nursing journey was influenced by two remarkable ladies who were mentors initially, and then they became friends. I had the opportunity to firsthand see them in the field where they were able to show their unwavering dedication to their patients, their commitment. And based on what I was able to witness, I decided that I would embark on this journey to make nursing my career path as well.
Okay. Now, nurses, as you know, I don't have to tell anybody in the room this, but play a very critical role in healthcare. So can you tell me what are some of the most rewarding aspects of being a nurse?
Well, for me, I would say with nursing, when you think about it, you start with patients or humans from the beginning of life to death. So you get to influence people throughout their lifespan, and you get to make an impact to help them remember that health is important.
Okay, and no matter how old or how young.
No matter how old or young, you just, you get to make some kind of influence on them.
Okay, Gerard?
For me, it's about seeing people get well. And getting well depends a lot on how that person would have come in the hospital. My yardstick for everyone is based on what they come in with and how they progress forward. Your 100% may not be another person 100%.
Right.
But just basically saying that person's, for example, come in, not being able to walk, and they leave hospital just with a walker. For that person, that that right there can be their 100% the
Yeah.
pinnacle, and I enjoy saying that.
Yeah. It's monumental to see people
Yeah.
move across the spectrum
Yeah.
in terms of how they come in and then how they end up leaving. Okay. All right. Obviously it's difficult to have any conversation around healthcare in this current time frame without kind of having a look back at the COVID pandemic. So particularly in the role of nursing, how would you say that it's evolved, especially considering the recent COVID-19 pandemic?
I would say that nursing has evolved where we were able to be innovative.
Mm-hmm.
We were able to find different ways of staying in contact with our patients so that we could continue best quality care. After the pandemic came telemedicine, in-house visits from physician,
Right.
to access patients who, for one reason or another, were not able to come out because of the pandemic, maybe due to comorbidities, and persons were still afraid of
Re-entering the world. Mm-hmm.
of the COVID-19 pandemic.
All right. Obviously, nursing is can be a very challenging job. There's a lot of study, a lot of work, a lot of time leading up to even just getting into the career. And then it's the day-to-day challenges as well. So can you highlight some challenges that you face in your day-to-day work as a nurse and how you found ways to navigate those challenges?
Well, for one, I'd say the nursing shortage has always been, I guess, a challenge in nursing.
Mm-hmm.
And so what we've done in our unit is that everyone's basically jumped on board, and we kind of interchange roles so that everyone is the best team player they could be. And
Mhm.
sometimes that means stepping outside of your exact job description, but you have to do what you have to do to get the job done and to make sure that patients have the best outcome as possible.
Okay. Um, Nurses also require quick thinking and decision making in high pressure situations. Anybody have a memorable moment, experience where you had to think on your feet and quickly adapt in a specific situation?
I mean, I would say that every nurse have stories, not just one, many stories. Um, to pick one, um, I would have to say recently, just at Doctor's Hospital, um, as a supervisor, several weeks ago, we had a particular patient that came through, and I remember vividly just looking at her, talking to her. She did not look as ill
Mm-hmm.
as it appeared, but assessing, and I guess it has to do with your years of being in the field,
Mm-hmm.
using all of your senses, talking to people, and evaluating. I was able to just calmly touch my colleagues and just say, with this one, we need to move fast. We need to get her up to the operating room as quickly as possible. And I did that without scaring the patient.
Mm-hmm.
And we were able to get her in as quickly as we can, direct admission straight in. And we were able to do a lot more than we would have if we had waited.
Yeah. I mean, I think it speaks to your earlier point about what is 100% varies from patient to patient. I think that the same thing applies when you talk about pain tolerance and things like that. So somebody might be in a life-threatening situation, but they're sitting down and they're talking to you very normal because their pain tolerance is just higher. So I imagine that's kind of along the lines of what you're looking at and kind of navigating that. Anybody else want to add a memorable experience that you've had?
Similar to what Gerard had said, I remember there was a patient who seemed pretty stable.
Mm-hmm.
Discharge planning was actually in process for him to go home in a day or two.
Mm-hmm.
And while being visited by family members, suddenly they made an alarm. Apparently, he had stopped breathing.
Oh, wow.
So, with quick action from the team, we were able to start resuscitative measures, and thank God that the outcome, it was a long road, but the outcome was favorable.
So nursing can be a very emotionally demanding job. I think Juliatta mentioned, you see people from the beginning of life straight through to the end, and all of the different ups and downs and interesting things across that journey. But how do you, as a nurse, given the demands of the job, how do you prioritize your own self-care and maintain your well-being in the midst of the demands of the job?
Well, as a new nurse into this career, I feel I've definitely had to learn how to do that fast.
Mm-hmm.
My nursing career started during the COVID-19 period where sometimes you work for 6 hours at a day. And like when you get home, it was really hard to like decompress.
Mm-hmm.
So what I've learned from that experience is to decompress and to make sure to take your days off and take your vacation days. I love to travel. That's my second hobby. So once I get a couple of days off, I on the airport. So it helps me to decompress and just breathing a different atmosphere and trying to stay focused on my mental health and self-care.
Mm-hmm.
It helps.
Okay. Gerard?
For me, because I've been in it for a while, I realized that you need hobbies.
Mm-hmm.
Okay, you need to, when you're off the job, to be off the job.
Right.
Okay, and mentally, you need to clock out.
Mm-hmm.
Okay, I have hobbies.
Mm-hmm.
There's a lot more that I could do outside, and it helps you to be a better nurse when you come back in, because we see a lot of pain, we see a lot of suffering.
Mm-hmm.
Okay, you need a change of environment, you need a change of pace, you need a change of seeing all of that
Right.
stuff. Too much of that is not good for you mentally.
Mm-hmm.
And when you come back too with a new appreciation for life itself,
Mm-hmm.
not just patient care. And so
Yeah.
you really need to have hobbies.
Yeah, because when you go and experience life, it kind of reminds you of one of the reasons that you're operating the space in the first place,
Right.
which is to help people get back to them being able to experience life in as normal a way as possible. It actually reminds me a little bit of the answer, because we had a similar question on our podcast with Dr. Thompson was on, Erica Thompson, our director of infection control, and she talked about she turns her phone off for 2 hours. She has time that she spends with her grandkids, things like that. Just remembering outside of the space what it is to live life. And so, like you said, you come back and you help people to get to that as well. You want to add anything, Charlene, before you move on?
I agree with my colleagues. It's very important to prioritize self,
Mm-hmm.
family, very important, and they do help to boost your energy. Sometimes you've had a rough shift, you're burnt out, but they help to rejuvenate. Do what you love, your hobbies.
Mm-hmm.
Spiritually, you have to take care of the spiritual man as well. So your support system, your system is important. That just as how you invest at least 80 hours every fortnight into the workspace, that you take care of the other aspects of your life.
Right. And I know I've heard from a lot of different people within the medical field, physicians and nurses alike, and there's some very interesting hobbies that people get into. I know people who've been training to do like to be a pilot on the side, all kind of interesting and wild and crazy things. Good conversation so far. We're gonna take a quick break for some words from our sponsors, and then we will be right back on the Doctors Hospital podcast.
Are you uninsured and seeking a plan that can give you quality healthcare at discounted rates? Unlock affordable healthcare with Doctors Hospital's LAMP. Enjoy unlimited primary care visits, exclusive discounts of up to 20%, and complimentary imaging and nutrition services. Visit doctorshosp.com/LAMP to register. Comprehensive, cost-effective wellness starts with LAMP.
Back to the Doctors Hospital podcast. If you missed it at the start, we're obviously talking to 3 of our nurses here in the hospital about their experience in going through education and their career path as nurses. So obviously, let's move on. Nurses are often advocates for their patients. Can you share a story where advocating for a patient made a significant difference in their care?
Well, I can share an experience. Just recently, I'd say maybe a month ago,
Mm-hmm.
I had a patient who condition changed, and me being one of the first persons that they would have encountered coming in as an outpatient, I realized after the procedure that they had their surgery that they seemed a little bit disorientated. Vitals were stable, but When I asked them how they feel, the patient replied that they're not breathing so well. I feel like their breathing has changed. But like I say, vitals were fine. So I spoke with a physician, and because the vitals was fine, and I guess just off first glance, the patient looked okay. But eventually, the patient did progress into respiratory distress. But I was the advocate from the patient first told me that they were having breathing issues because you can't, in nursing, you always say you can't monitor how a patient is doing by the monitor. You have to actually talk to the patient
Mm-hmm.
and do a physical assessment and see how they're doing. And you just have to make a difference and just let everyone know, like, hey, this patient's not doing okay. And you do that until you get some attention.
Right. Okay. Anybody else want to add?
What stood out for me was a patient who recently had surgery and wasn't progressing as he was supposed to.
Mm-hmm.
After speaking with him in depth, it was quite evident that his pain was not controlled and he was afraid to speak out, afraid to be a bother because he realized that the nurses were already overworked.
Mm-hmm.
So being an advocate for him, I was able to speak with his physician to point out that what the medication he was on was not working, and we saw how best we could add other stuff that would help with his recovery, get him more involved in physical therapy so that he could have had a short hospitalization.
Okay. Now I know nursing, just like anybody else that works in the field, often works in a multidisciplinary space. How do you foster effective communication and collaboration with your team? Especially, I know you have 2 supervisors in the room, so I imagine that's even more crucial for you. But how do you foster effective communication?
It starts with being intentional.
Okay.
That's the first thing. Why are you having this conversation? What do you hope to achieve by having this conversation? It starts by listening. Good communication always starts by listening. You have to listen. You have to hear what the person is actually saying. You have to comprehend. Okay. You have to allow the person to respond. And then it means using words that are impactful and getting to the bottom of what you need to get to and really conveying it in a way that is understood, that is not going to cause any more emotional distress, and to achieve what you need to achieve.
Okay. Good points. Anybody else want to add to that?
To add to what Gerard had said, it's mutual respect, doing it respectfully.
Right, because you're all members of the same team working to achieve the same goal.
Right.
Okay.
I'd like to also point out that the hospital does a good job and ensuring that everyone does their annual competencies. And a part of one of the competencies, it speaks about therapeutic communication. So like every year you have to do that like little refresher and it really helps.
Okay. Awesome. Again, in healthcare and in nursing in particular, it's a lifelong education journey. What are some of the ways you, and I think you spoke to this just now in terms of even the competencies, but what are some of the ways that you stay updated with the latest developments and advancements in nursing?
For me, it's keeping abreast with online courses, making sure that I am privy to the latest information that's there, that our patients continue to get care that is high quality based on evidence-based practice and not outdated. Also to peer literature reading, that has helped tremendously. And the hospital, again, is very good in terms of in-services to keep us abreast and up to date with our skills and what's current in the healthcare industry.
Okay. So the nursing profession has many specialties. Obviously, we know for Juliatta one, you're obviously in one of those, being in post anesthesia care. So we'll probably start this question with you, but could you talk about your area of expertise, what makes it different, and what drew you to it? I think we obviously might know the answer to this question based on our lead-in, but feel free to expand on that.
All right. So, like mentioned, I work in the post anesthesia care unit, and we call it recovery room, but it's the initial phase when you come in to have a surgery done, and it's the end of the surgical phase. So we do pre-operative and post-operative. So what drew me to this area, was I always enjoyed having patients come in to have surgery, and it's honestly a nerve-wracking experience, but you get to be that first touch, and you get to calm those fears. and you get to basically have a little moment where you get to be a little bit, you experience patients being vulnerable and you get to make an impact. And that for me drew me to the area, as well as after when they're finished with their surgery, they come in to recover. Watching someone become back orientated from being lost, we always make a joke and say, you reach back NASA yet? Or you still in Inagua? Like that whole experience is honestly individual, and every time it's a different experience. So it's pretty fun, I'd say. But you get to do critical skills, you get to do basic nursing skills. So for me, I'm able to use all my skills and I love it.
I would like to stay married. So there's a story that I won't tell. My wife has been in surgery a couple of times, and there's one particular experience that I won't share. But I will say this: from my experience watching someone come out of surgery and regain themselves from anesthesia. Obviously, once the patient is good, I imagine you have some very interesting and comedic stories about the things that people say as they're coming back from anesthesia. But like I said, I want to stay married, so I'm going to keep my story to myself. I have to get clearance before I tell that story on air. Anybody else want to add to what drew you into your specialty?
Well, my specialty is operating room, which is basically the opposite of Leary.
Okay.
I have to deal with the patients internally and the actual surgery, and then they go out to the recovery room. What drew me to that area was my curiosity, first of all, for anatomy and physiology. Is nothing like seeing the human body. There's nothing like seeing the various parts. We could all look at a nice diagram of the heart, but when you see the heart, when you see it beating, when you see a liver, okay, when you see bones, what they look like when they're broken, that's a whole other story. And that's beyond textbook.
See, that's just why I'm on this side of the microphone. That's just why I'm on this side of healthcare, because I can talk about it, I can promote it. I'm not standing in the OR looking at anybody's heartbeat. That's gonna stress me out. But obviously, that's I imagine it's an amazing experience, especially for someone who has that interest, and you've always had the interest. You mentioned being into it from you were very young. So being able to see all of the inner workings just kind of laid out before you, I imagine is a tremendous experience.
It is.
Awesome.
My area of specialty is critical care. I was drawn to critical care nursing because of the fast pace, the autonomy that it gives you to be involved with your patient care. Also, too, you're the bridge between a patient who is when they're most critically ill and the bridge between them and the family. It's overwhelming for some of us as nurses. So I could just imagine for the family. So it's being there as a support to guide them each day, each hour as the person continues to recover, so they could understand what's happening in the critical care setting.
Okay. And for our listeners, critical care is the ICU?
ICU.
Okay. All right. Just want to make sure, that's clear. All right. So we talked about education a little bit before from the standpoint of you becoming educated and staying on top of the latest in advancements and technologies and things like that. But nurses are also on the forefront of patient education. So how do you ensure that patients understand their care plans and they feel empowered in managing their health? Because you mentioned, there's a gentleman and he didn't feel, for whatever reason within his own self, that he would be able to say, hey, I'm in more pain and things like that. So how do you help people in that space as a part of your job as being a nurse?
Well, first, you want to make sure that the information that is being imparted to the patient is clear, plain, simple language, ascertain feedback to make sure that they understand clearly what is being said to them. For visuals, you'd like to have visual aids instead of just literatures, visual illustrations, and ask for demonstrations. Summarize at the end, get a summary from the patient, exactly what do you understand from what we discuss.
Okay.
And encourage them to stop you at any point to clear up any miscommunications that they are not clear.
Okay. Now, I also know that nursing is a strong community, has a strong sense of community amongst nurses. Similarly with other areas of healthcare, there's a very tight fraternity. How do you support and uplift your fellow nurses, especially during challenging times?
Well, for me, I'm the jokester on the job.
Okay.
In between us having periods
See, because
of
all you have is funny
chaos.
stories of people coming out of anesthesia.
In between of having periods of chaos and what seems to be disorganization, I've seen nurses who are experienced be flustered and nurses who are just coming to job be flustered. So I tend to draw to people who seem to be freaking out. I guess that's my thing too. I always try to crack a little joke or like, you can get through this. Like we make it happen. Like this the A-team. Like I'd always try to say that
Ease
to my
the tension.
coworkers to try and get things to go a little bit more smoother, because once you're not focused, it does affect the patient. So I try to make sure my team and all of my colleagues were on top of it. And if we have to laugh through it, we do it. We got to do whatever we got to do.
Just piggybacking off what Leary say, I have a joke, and I normally, when people around me start getting flustered, my team members, and I look at them and I just basically say, it's okay to be like that, you want to throw something, you can throw something on the ground too, but the one thing that I don't want you to say in here is oops. We don't say oops in here.
Especially not Noir. That's not a space for oops.
Yeah.
That's good.
Again, it's just being supportive. Teamwork gets a lot of things done. If you, for example, don't have a heavy work assignment and you see where your colleague has a heavier load, then assist. Be there. Be supportive. A listening ear. And try and put their wins, their accomplishments, whether it's personal or professional.
Okay. Awesome. All really really good pieces of advice and good ways that you guys do that. I think we touched on this a little bit earlier when we talked about self-care, but I want to take it just a step deeper, because May is also Mental Health Awareness Month. So the pandemic in particular has brought a lot of attention to the mental health struggles of healthcare workers. There's a lot of death that people saw. There's a lot of pain, a lot of heartache throughout that process. How can we better support the mental well-being of our nurses?
Well, I think we have a great support system right now. I want to commend all of our nursing supervisors. They, at every shift, they come in and ask us how we're doing, and they don't normally just focus on patient-wise, how everything's going, but they truly want to know if you're okay. And I want to commend them. They do a great job at that. But I'd suggest that we do more recreational activities. Like sometimes it's best to get outside of the hospital. Like most of our activities are hospital based, but if we could do a little bit more recreational activities outside the hospital for those of us who can attend, I think that'd be good.
Okay, awesome. Good idea.
And I know, for example, the hospital has been very good. There are times when we have colleagues or patients who we have lost. That's where, every patient is dear to us, but this one maybe have grown on us because of the length of stay in hospital. Then they do provide support, usually mandatory, where you have to have a one-on-one with pastoral counsel.
Okay.
All right. And that helps.
All right. Okay. So finally, as we wrap up our conversation, and obviously we're celebrating Nurses Month, and this week again is Nurses Week. So for each of you, what message would you like to share with your fellow nurses and those who may be considering entering the profession?
Well, I want to first say, I always say nursing is a lifestyle. So once you're drawn to it, you can't really run away from it. So if you feel like you have the calling, do the education, find a support, a mentor, maybe someone in the field, and talk to them about it. But we need your help. Get involved. It's a great and rewarding profession. I definitely encourage anyone who's interested to join. It's an amazing experience, and I wouldn't have it any other way. I'd definitely be doing nursing for a very long time.
Awesome. Gerard?
I'd just like to say that during this nursing month, I really would like to encourage all nurses to stay the course and to continue to give good care. For those entering, to know that the profession gets hectic at times, but it is rewarding.
As we celebrate Nurses Month, I want to express my gratitude to all my fellow nurses. To the new nurses, welcome to this noble profession, and the learning has just begun. To those considering nursing as a career, I would say pursue your dream. It is a rewarding profession. There's endless opportunities for continuous learning, continuous growth, and to make an impact in a person's life, a community, and the world at large.
Awesome. So I personally want to thank you guys not only for being on the podcast, but for all of the work that you do. I think as we've covered going through this conversation, nursing can be a very challenging and demanding job with a lot of experiences that can be both exhilarating, rewarding, but sometimes challenging and rough periods to get through. And I think having nurses across the spectrum in terms of the areas of the hospital, as well as different stages of your careers being nurses, I think it's a very good conversation. And I want to thank you all for joining us today.
Thank you.
Thank you for
My
having
pleasure.
me.
It was a blast.
All right. So for our listeners, as always, we invite you to like, comment, subscribe, and share the podcast. And we will see you here next week on the Doctors Hospital Podcast.
Looking for the perfect place to fill your prescriptions? Doctors Hospital Pharmacy is your go-to destination for exceptional pharmacy services. Enjoy low prices on the most common medications, up to 20% off self-pay prescriptions, and fully waived co-pays for insured persons. Try our free delivery service for added convenience. Doctors Hospital Pharmacy, where health meets affordability. Call us today at 302-4785 for the best in pharmacy services.